Hello, everyone. This is Don McAnelly with Rehmann Healthcare Management Advisors. Happy today to have Carmel Roberts with me today. Carmel is the practice administrator for Valley OB-GYN in Saginaw, Michigan. I'm going to talk a little bit about some issues that are probably pretty pertinent to all practices right now. It's the impact of the pandemic on your practice. Carmel, I know you've been dealing a lot with this as you've been helping to lead Valley OB through the pandemic, and I might say rather successfully in what you've done in the steps and how you've been progressive in implementing steps to help them, guide themselves through this real unknown, uncharted water in the pandemic. So I'd like to talk to you a little bit about what you're seeing, what you've been able to do, and how you've been able to help the practice be successful.
Well, thank you, Don. It's always a pleasure to talk to you, and I would be remiss if I didn't start right off the top and acknowledge that Rehmann, and with your help, was a very good partnership through 2020 and just in general, but I think everyone would agree that 2020 will forever have an asterisk by it, not just in a balance sheet, but just in every other respect in life. But, certainly it was a year that tested everyone's contingency planning skills, I would say. And going into 2020, there's already a headwind of change in the medical industry and healthcare in general. I mean, anytime you're in an industry that is facing, compounded cost increases year over year, you couple that with the fact that because of the unique revenue reimbursement structure, we don't get to pick our prices. So if you have cost increases and you can't really control your prices, you can't charge more for things, then you really have to be creative. So if that is the backdrop to a pandemic that hit healthcare industry and across the board internationally, you're in for a good year that will test your mettle. I think for us, looking back, some of the bigger challenges that I'm quite confident weren't unique to Valley OB-GYN. Healthcare is very slow to change. And then it would be a whole other podcast, that we could delve into why that is. But I think that is a true statement that healthcare is slow to change. And in 2020, you took years of change and you compressed it into months. And a good example of that would be telehealth. Telehealth is something that, people had dabbled with. There were certainly vendors out there in the market that were trying to convince the healthcare industry of the value of utilizing telehealth. But it took an impetus like the pandemic to bring that all to the forefront. I think I'd read somewhere that post 2020, the increase in use of healthcare or of telehealth and healthcare went up 64%. I mean, that's just an astronomical adoption rate of any technology in a marketplace, but healthcare, that's, I think, significant. And for us, that would be true. We had been using telehealth since 2017, but nowhere near the way we had to put it into our workflows in 2020.
Hey, Carmel, one of the things I've noticed in working with so many practices and clients around the state and really around the country is some of them pivoted well. Those that had really made the investment in technology. You mentioned earlier, you said, healthcare is kind of slow to change. I think you're right. I think with the increasing costs of overhead and kind of the flat revenue streams, many practitioners just hadn't really made the commitment to invest in the technology, whether it be the hardware, the software, the bandwidth to make this happen. I mean, that's been something that I think has really been, those that had been a little forward thinking and making those investments were able to make it work, certainly a lot easier than those that weren't. What are your thoughts on that?
I think that's very true. I think that using technology in healthcare, just the delivery of care, is counterintuitive to the providers themselves. It is a very different type of thought process to, you can't map a paper chart workflow into an electronic medical record. It's not a one-for-one. So there's a natural reluctance there. But I guess I'll just speak from what I know, which is our experience. As you pointed out, we've been on a 5-year journey before 2020 into evolving our practice into a fully modern practice, which has an IT backbone to it. And I would say that that was one of the most significant things that we've done. And the return on that investment really was underscored in 2020, because we were able to easily pivot to telehealth when we needed to. And we did that in a matter of 36 hours. When they shut down, when we shut down in Michigan, we had all of our patients scheduled out for 2 months. So we were able to go through our schedules and determine which patients we absolutely had to see in office. And a lot of that was driven by high risk factors because we're OB specialty. But for the rest of them, we could just easily convert that to telehealth and manage their care more remotely. So had we not had that already in place with all of that backbone, we would not have been able to do that so readily. In a 36-hour period, I think that was pretty, for me, that was a high point. You know, nobody has that kind of success without, you know, investing in the technology, but our team was comfortable with it because we've lived with it for long enough that it is very much part of how we do everything in the practice. So it's just part of our culture now. But it is significant. I think, in my personal opinion, going forward, that is the future of healthcare. I don't see, you will still have some holdouts, of course, but 2020, as I said at the top of this, it compressed years of change of what would otherwise take, you know, 10 years into months. And I think that the technology is probably the differentiator there. And you saw that, not just in telehealth, but, you know, going forward, now everyone is looking at all of the data that you collect. Now it is high risk, it's population health. So COVID, if you were a high risk patient, you had to know who your high risk patients were. You had to be able to easily identify them to know who needed to get a vaccine. And you couldn't do that if you just had paper charts. You can do it if you have electronic medical records and you utilize data analytics effectively, but not in paper. So I don't know if that answers your question, but I mean, there were just a number of instances. It's a very good point, Don, that our investment in technology made all the difference in the world in 2020.
You know, you look at the platforms and people putting the technology in place, you know, while certainly the remote visits were a benefit to the patients, okay? But, you know, some of the clients I work with that are maybe, you know, maybe they're a real subspecialist and they're so valuable to that community. And not only were we concerned about the health early on in the stages of COVID, the health of the patient, of course, but also the health of the provider was becoming a big issue for us. If these providers, you know, contracted COVID, you know, I've got some clients I work with that were a little bit older. And these are physicians that were in their 60s and 70s that maybe had some health issues themselves to monitor a little bit. So they were, just like patients were concerned about interactions, these providers were also concerned about interactions with patients right there, and for good reason. You know, especially in a certain area, if they're a subspecialist, you know, making sure that, you know, that they're there and able to produce is extremely important for that community. And Carmel, I've seen some clients tell me right now that, like you'd mentioned, that this is not just a blip that's just here during this pandemic time, that this is probably going to be a way that business is conducted for a chunk of healthcare going forward. Some of these providers I'm working with are telling me, I'm going to be doing telehealth visits is the way that I'm going to be doing it. I'm not going back into the clinic setting. I'm not going back to the office. This is probably the way it's going to be for the balance of my career. And where you mentioned that, this is really compressed change. Imagine being a provider who's been in the business for 30 to 40 years and seeing so much change. Paper charts going to EMR several years ago and having to wrestle with that. And now going to this level and using technology here, it has really been a kind of a warp speed for them to get to this point. So it's been a huge change for just about every provider out there.
Yeah, I think that is a very good point that will start to manifest itself as we see the long-term impact, not just on practice patterns or care plans and how they're managed, and whether or not the uptick in telehealth continues to be there. I think from what I've been reading, certainly the telehealth vendors think that it will be. They're predicting a 38%, compounded annually, which is a 7-fold increase over the next 5 years in the use of telehealth. So this really was the shot heard around the world in terms of how we deliver care. I do think, though, it's a cautionary tale. I mean, I think the flip side to that, if you're going to look at it, is there is a real risk to me that while it's convenient, we've certainly made a good case for that, and it was very effective in the pandemic setting. It definitely has its role. I think that for smaller providers, for independent practices like ours, the risk here is that this rapid change to a hyper IT setting for care delivery, the cost and the overhead to that on top of the regular cost and overhead could lead to a lot of mergers and acquisitions. So you have fewer, smaller carrier or smaller providers like we have. And I don't know long term, if we're looking at effectively managing an increasingly high risk patient population, if doing that in a virtual setting, to a large extent, if that's the best course of action. If the corollary to that, I would argue, is, the school setting. That was necessary, for students to do that to keep them safe. But I think there are very few students that really did well overall over the long term. So I think it's something that's got to be really looked at and evaluated, and we have to come to an understanding of what kind of criteria are the most important. Is it the bottom line? Your balance sheet? That's absolutely, everyone makes a rational decision based on, cost and revenue. So that's got to be in there. Is it effectively managing high-risk populations, the emergence of big data and population health? I mean, that has a role. I think there are a lot of advantages to it. Is it being able to deliver on the idea and the theory behind value-based care, that we're going to set some expectations? I think that becomes the tricky part. I don't know that you can effectively deliver on value-based care. You might really be quite adept at managing population health and big data, but I think that is very different than delivering effectively on value-based care if you're just going to do that through a spreadsheet or telehealth. Mm-hmm. People have Zoom fatigue. I mean, everyone has Zoom fatigue from being in their basements for a year. So I think that'll be an interesting point. I've probably gone on about that quite a bit, but
Carmel, as we wrap up our discussion on this impact of the pandemic and impacting your practice, one last thing I'd like to get your thoughts on is the impact of all the use of telehealth on the revenue cycle. I know there was some concerns how the payers were going to handle this. Were they going to see the value in this, and were payers going to reimburse for this service? Any thoughts on that?
The payers stepped up And I think that they saw the utility in it. Certainly you have a lower overhead to it. So if you're looking at it through that lens, it certainly has a lot of attractive features to it. The one challenge that I will say that we encountered that we didn't anticipate on the front end was an increase in self-pay, with COVID and unemployment benefits and things like that, coupled with the fact that if you're virtual, it's really hard to collect on a balance or a copay if the patient's not in front of you. It changes the dynamic entirely. So, that was, not an insignificant obstacle that we really, it's one of those things, it's a trend that you see after it's already happened. It's not a pleasant surprise to find out that your patient AR is really out of whack, which ours was for a little bit. And you never want to be in the position of denying care because they have a balance. I mean, not in our specialty. I mean, you could be following up on mammogram results or an OB ultrasound, and if those are bad outcomes, you definitely don't want to delay providing that care. So that was a bit of a challenge.
Yeah, certainly challenge has kind of been one of the themes of 2020, Carmel. And as we have this discussion here in March of 2021, it doesn't appear to be really lightening up all that much. We're starting to see some things opening here from state level perspectives around the country. Michigan seems to be slowly opening back up as the vaccine continues to get rolled out, but I guess we'll continue to see what the impact is going forward. So Carmel, thanks a lot for joining me on this discussion regarding the pandemic's impact on your practice. And thank you guys for listening in, and look forward to continued discussion on other pertinent healthcare topics.
My pleasure. Thank you, Don.